My name is Chidi Wamo, and I am a member of Doctors for America. But before we get started, I wanted to take a quick minute to invite you to officially join DFA. Being a DFA member today means taking the important and simple step of selecting a membership level and paying your annual membership dues to support DFA's organizational sustainability. There are 6 different levels to choose from. A DFA team member will put that link in the chat for you. We will be live streaming to Facebook Live and making a recording, and all materials will be available afterwards. Now, a few quick ground rules. We encourage participation, but if you have questions, please hold on to them as they will be answered during the second half of our session. And feel free to utilize the Q&A feature or also raise your virtual hand, and we can help facilitate the conversation as questions come in towards the second part of the chat. Now, on to today's speaker. We are thrilled to welcome Maritza Perez. Maritza Perez is the Director of Federal Affairs at the Drug Policy Alliance in Washington, D.C., where she leads the organization's federal legislative agenda and strategy to end the drug war. In this role, she lobbies Congress and the administration on issues pertaining to drug policy and criminal legal reform. Maritza convenes the Marijuana Justice Coalition, which successfully pushed for the passage of the MORE Act in the U.S. House of Representatives in December of 2020 and this past April, making that the first and only time in history a congressional chamber voted in favor of descheduling marijuana. So without further ado, I will now pass it over to Maritza for a presentation this evening, and thank you for everyone for joining and tuning in.
Thank you so much for that warm welcome. I'm so excited to be here with you all tonight. So for those of you who don't know the Drug Policy Alliance, we're a nonprofit that works to end the harms of the war on drugs. I run the federal office, but we're headquartered in New York. We've been around for about 20 years, and we work at the state level, although again, my office works at the federal level. We really approach our work in 2 ways. Like when I think about the work that we do, I think about it in 2 big buckets. We have like our public health bucket, and that encompasses things like harm reduction and really advocating for evidence-based public health solutions to problematic drug use. But then we also work on criminal legal system reform because unfortunately, as we know, substance use right now is treated through the criminal legal system. So we're trying to reverse course on that and really emphasize the need for a public health approach to ending the harms of the war on drugs. At the federal level, my office engages mostly with Congress, the U.S. House and Senate, but also with different different agencies within the administration, including the White House, the Department of Justice, ONDCP, Health and Human Services, agencies that touch on drug policy. So with that overview, I did want to just give you a general overview of what I'm going to be talking about today in my presentation. If we can go to the next slide, please. So today I'm going to be talking to you all about marijuana, including the bill that was mentioned in my introduction, the MORE Act, the Marijuana Opportunity Reinvestment and Expungement Act. I'm going to be talking about drug decrim and our federal bill, the Drug Policy Reform Act. I'm going to be talking a bit about fentanyl and what's been happening with the conversation around fentanyl at the federal level. And I'll talk about the TEST Act. And then I'll talk about other issues that touch on drug policy that our office works on. So starting with marijuana and the MORE Act. For many years now, since the inception of the Drug Policy Alliance, we've seen different ballot initiatives and different marijuana reforms pop up at the state and local level. About in 2018 or so, our coalition, the Marijuana Justice Coalition, came together at the federal level because we were seeing all these states pass marijuana reform, but we felt that oftentimes the social justice was missing from those reforms. So we also read the writing on the wall and saw that all these states are loosening their marijuana laws. Actually, today we live in a country that has loosened most states in this country have loosened their marijuana laws to some extent. So we knew it was only a matter of time before the federal government did the same thing. We wanted to make sure that when they did it, they centered people who have been most harmed by marijuana prohibition. So we built a very diverse coalition made up of people who are formerly incarcerated, civil rights groups, traditional drug policy groups, but also other allies that you wouldn't necessarily think about, like labor and immigration groups and social workers. Again, we wanted to bring in a diverse perspective in this coalition because we understand that the harms of marijuana prohibition are broad and comprehensive. They don't just touch the criminal justice system, but they touch other aspects of a person's life. So the Marijuana Justice Coalition worked to build a bill that we thought would really push the envelope in Congress, and that bill was the MORE Act. And the reason this bill really did push the envelope was because it really was the first bill to center people who have been most impacted by prohibition. And let me talk about the bill provisions just to give you a better idea of what I'm talking about. So first and foremost, what the bill did was remove marijuana from Schedule 1 of the CSA. The CSA, of course, is the Controlled Substances Act. Schedule 1 is usually reserved for drugs that have no medical value and high potential for abuse. These are drugs like heroin, LSD, ecstasy. What's important to know about Schedule 1 drugs is that they also carry the harshest criminal penalties. So for us, it was really important that we remove marijuana completely from the list of controlled substances, move it off the schedules completely. This is called descheduling. This is important for a couple of reasons. Mainly because as long as marijuana remains anywhere on the drug schedule, whether it be 1, 2, 3, 4, or 5, there are 5 drug schedules, criminal penalties will apply. And we wanted to make sure that we avoided future criminal penalties, but also gave people an opportunity to come in front of a judge and say, hey, this isn't a crime anymore, I should be resentenced. So for us, descheduling was important, and it removes marijuana from Schedule 1. In addition to that, the bill changes the word marijuana to cannabis in the federal criminal code. So right now, if you look at any federal government document, the official government term for marijuana is marijuana instead of cannabis. When we're talking about cannabis, we're talking about the whole plant. It's a scientific name for the plant. But a decision was made in the 1930s to call it marijuana in order to target a specific segment of the US population that was unwanted, and that was Mexican migrants. The person who ran drug enforcement at the time wanted to make the substance, or the plant, I should say, sound scary and foreign, so they attached what Mexican migrants called it. They called it marijuana to try to, make it sound problematic, and again, attach it to a community that was unwanted. I raise that because we see this often in drug policy. If you look at the roots of a lot of drug policies in the US, like the roots of a lot of things in the US, there are racist underpinnings, and marijuana, unfortunately, is no exception. So for us, it was really important to remove the term marijuana from the federal code and call it by its scientific name, cannabis. In addition to that, the bill expunges and resentences marijuana convictions. So expunging a record means that it takes the record away for that person so that they won't be judged on the record, and it'll make it harder for them to, when the record is not expunged, it makes it harder for them to find things like housing or receive federal benefits or even apply for some job. So it was really important for us that we expunged the record. And that, again, we resentenced convictions so that people had an opportunity to come in front of a judge and get resentenced post marijuana being legal. One interesting thing about the bill is that it takes marijuana tax revenue and reinvests it in communities that have been most harmed by the war on drugs, low-income communities of color. And it does this in a couple of ways. One, it creates a community reinvestment fund to provide things like expungement services and other legal services, job training, literacy programs and libraries, social service, essentially, for communities that have been most harmed by prohibition. It also provides money to the Small Business Administration, specifically to fund minority-owned businesses that want to get into the cannabis space. And this is important because we know that as marijuana has increasingly become legalized, it's also been commercialized. Unfortunately, the industry remains very white, very male, despite people of color still facing the brunt of convictions and still carrying the burden of arrest in most places, even in places that have decriminalized. So it was important for us to make sure that we also build an inclusive industry. because, we have some people who are making billions of dollars off a plant while others are still suffering criminal justice consequences. Another thing that the bill does is it ends collateral consequences that are attached to federal marijuana convictions. So for example, federal security clearances, sometimes if you have a conviction or even an arrest or admit to marijuana use, your federal security clearance for a federal job might be denied. So the bill would take that away. It would also make it so that you can't be denied public benefits because of your marijuana conviction or marijuana use. Public benefits are things like SNAP TANF or even federal housing. One thing that we also wanted to address was immigration. So the bill would also make it so that people could no longer face immigration consequences for marijuana activity. And this is really important because even though marijuana, again, is increasingly legal in many states, if you're a non-citizen, and I'm not even talking about, it doesn't matter like if you're here legally or not legally, as long as you're a non-citizen, you can still face really harsh criminal penalties and immigration penalties for marijuana activity, even if you're in complete compliance with your state and local laws. And a lot of non-citizens have no idea and don't know this. The reason these federal penalties apply or immigration penalties apply is because marijuana remains a Schedule I drug. So somebody could be in complete compliance with state and local laws, but still could face automatic detention and deportation and other immigration consequences if they are caught with marijuana or even admit to marijuana use. So for us, it was really important to address that in this bill so people could no longer be detained and deported for marijuana offenses. And I do want to point out that, even we saw this with this past election, 2 more states chose to loosen their marijuana laws. And we're at a point where people, I think are really seeing the light around this issue across party lines, across demographic groups. There's a lot of popular support for marijuana. Nonetheless, marijuana continues to be extremely criminalized. We know that there are more than 500,000 arrests each year for marijuana possession, impacting disproportionately people of color. So comprehensive legislation is really still really important despite the progress that we're making in the states. The MORE Act has now passed twice in the House, as was said at the beginning of this presentation, including earlier this year. And now there's another bill in the Senate called the Cannabis Administration and Opportunity Act. And this bill builds off of the MORE Act. So it's the MORE Act plus tax and regulatory framework. So I really like to think about the MORE Act more as a decrim bill because it does not really have a tax and regulatory framework. It was mostly focused on criminal justice and social justice. Whereas the Senate bill, the CAOA, builds off of the MORE Act and also adds a tax and regulatory framework, which to me really speaks of legalization, because when you're talking about legalizing a substance, you're normally talking about a regulatory system for the legal market. So it's a good bill. It continues and built off of where the MORE Act left. That bill was recently introduced, I think July of this year. We're hoping to build more co-sponsors and we get more support for the bill. But you all know that this Congress is just about up. After the election, when Congress returns, we call that the lame duck season. It's, when members just try to pass the last bills of the season before the new Congress takes over. So what I think will happen is that in the next Congress, the CAOA will be reintroduced in both chambers, in both the House and the Senate. And I'm hoping that really is the vehicle that legalizes marijuana. Of course, there's a lot of work that needs to be done in order to make that happen. Namely, we need to get Republican buy-in. For the most part, marijuana initiatives at the federal level have been driven by Democrats, although there are some Republicans who are very invested in this issue and are pushing for marijuana reform, but there's still a lot more work to do on that side of the aisle, which is kind of wild because, again, if you think about the popularity of marijuana, it's popular across party lines if you're talking about people and constituents. But what I find, especially working in the federal space, is that many times lawmakers are very behind where the people are. So it's not surprising to me that Congress still needs to catch up. Something else I want to mention is that in lame duck, this year, we do expect a narrow set of marijuana bills to pass that address other issues related to marijuana, like a research bill, a veterans bill, perhaps a bill related to marijuana and banking. But what we really want is a comprehensive bill that addresses the harms of prohibition in a comprehensive way, like the MORE Act did and like the CAOA does. And another reason that's really important is actually in light of the Biden announcement on marijuana. So you all might recall that a few weeks ago, President Biden made a huge announcement around marijuana. And that announcement included calling for expungements for federal and DC simple possession cases. He also called on governors to follow his example and also expunge these records and pardon these records. And he also initiated a scheduling review order, and that actually can have the biggest impact. So in other words, he directed HHS and DOJ, the agencies in charge of scheduling, to review marijuana Schedule I status. And again, this can have a big impact because I explained that if we deschedule, that could have huge ramifications in terms of criminal justice. And if we reschedule, that can also carry its own ramifications. Of course, we prefer to see descheduling, but we know that descheduling needs to be coupled with a bill. So we'd like to see this done through a bill. And I want to be clear, we were excited about Biden's announcement because you have to understand that a federal pardon is huge. It removes the legal disabilities and stigma that come with federal convictions. It removes penalties associated with federal convictions, and it really can help people access things like employment, licensing, housing, and federal benefits. However, it's important to point out where the announcement falls short. First is people with federal pardons still have conviction records. So to eliminate those records, there needs to be federal expungement to get rid of the record. Moreover, we also know that the vast majority of people have state law marijuana possession convictions, not federal. Federal is a small number. It's about 6,500 people plus people in DC. But if you look at the state, we're talking about millions of people. That's where the impact could really be felt. And we know that this action doesn't do anything for simple possession cases at the state level, except for encourage governors to pardon those convictions. We also know that people with state law convictions will still be subject to federal collateral consequences, and their record at the state level can still block them from accessing housing, jobs, and other things that could complicate them beating their families or even keeping their families together. Additionally, it's important to point out that the Biden announcement excludes all non-citizens who are not lawful permanent residents. And even immigrants who are pardoned pursuant to the announcement will run the risk of detention and deportation without further action. We believe that a just policy would provide relief for all individuals, despite what their immigration status would be. And like I said, to remove future criminal penalties and end draconian immigration consequences, what we need to do is completely remove marijuana from the CSA, from the Controlled Substances Act. And this is because as long as marijuana remains anywhere on the CSA, criminal penalties will continue to attach. On top of that, we know what we really need is the comprehensive marijuana package that deschedules marijuana and repairs past harms of marijuana prohibition, like past marijuana convictions, and avoids new harms like future arrests and convictions. So our end goal really is to pass a bill like the CAOA or similar legislation. Even if Biden decided to deschedule tomorrow, his administration might come back and say that they want to deschedule. That's great, but the war on drugs has been vast. Marijuana is a small slice of that. The criminal justice system is a small slice of that. There are various things that really need to be addressed to make communities whole again. And the only way that can be done is through legislation. So next I'll talk about the Drug Policy Reform Act and drug decrim. So why drug decrim? Like I just said, marijuana really is a small slice of the war on drugs. At the Drug Policy Alliance, we love to push the envelope, and there are many ways that we continue to do that. I think 20 years ago, envelope pushing was marijuana legalization. A lot of states hadn't done that at that point. But now we're thinking next. And for us, next is all drug decrim. We know that drug enforcement and the war on drugs have actually failed to reduce the supply and demand of drugs, while also increasing drug overdose deaths, and perpetuating stigma of individuals with addiction. Not to mention, we also boast the greatest incarcerated population in the world, standing at 2.3 million people. The war on drugs has fueled wide-scale militarized policing. It's cost taxpayers over $1 trillion since its inception, and it's expanded punitive institutions outside of the criminal legal system, including other punishment-oriented systems embedded in schools, hospitals, social service agencies, and even in the administration of our immigration laws, as I talked about. More people are arrested for drug possession than any other offense in the US, with one arrest every 23 seconds. This means that every 23 seconds, one person's life is turned upside down simply for possessing drugs. And we know that the collateral consequence of arrest or even any law enforcement interaction are vast and can really upend a person's life. In fact, we know that there are about 50,000 collateral consequences across the US that can impact the person's ability to get licensing, find housing, get a job, go to school. Collateral consequence upon collateral consequence that comes with arrest or conviction. So after 50 years of a punitive enforcement side drug war at the Drug Policy Alliance, we've said enough is enough. We're calling for a new approach to drug policy, and that's one that's grounded in public health. And for us, that means drug decriminalization. And what does that mean? It means eliminating the criminal penalties associated with drug activity, such as decriminalizing personal use and possession of drugs. At DPA, we believe that drug decrim is a good start, but we're also conscious of the fact that we need to be inclusive of expanding our access to non-coercive, non-punitive treatment, as well as harm reduction services and other public health interventions to treat problematic drug use. Drug decrim can have many benefits. Obviously, it can impact the number of people in our criminal justice system and help them avoid collateral consequences, but it can also curb the overdose crisis and promote the health, well-being, and the rights of people who use drugs. The concept of drug decrim is neither new nor radical. Other nations, including Portugal, have successfully decriminalized personal use quantities of drugs and achieved meaningful improvements in treating problematic drug use and reducing the harms of policing drugs. And in fact, support for eliminating criminal penalties for drug possession is growing across the US and around the world. In addition to our organization, leading medical, public health, human rights groups, and other drug policy groups have endorsed drug decriminalization. Groups like the United Nations, the World Health Organization, the International Federation of the Red Cross, and many others. And data from the US and around the world suggests that treating problematic drug use as a health issue instead of a criminal justice issue is a more successful model for keeping communities healthful and safe. This has also been successful in the US. In fact, the Drug Policy Alliance pushed for a Measure 110 in Oregon that passed in November of 2020. This was the first measure of its kind in the US. It eliminated criminal penalties for possession of drugs for personal use, while also increasing access to health and harm reduction services, including housing, and it established addiction recovery services. And these services were all funded with marijuana tax revenue, as well as savings from reduced arrests, prosecution, and incarceration. We're hoping that, as we saw with the domino effect of marijuana legalization, that this victory will inspire other states and the federal government to follow suit and enact their own drug decriminalization policies that prioritize health over punishment. Which leads me to talk about the Drug Policy Reform Act. So this was a bill that we introduced in the House in June of last year. It was co-sponsored by Representatives Bonnie Watson-Coleman and Representative Bush. They both have very interesting backgrounds. They both have public health professional backgrounds and also understand the impacts of the drug war. They've seen that very up close in their communities. This bill has about 20 co-sponsors at this point. The bill would end criminal penalties for drug possession at the federal level. It would shift regulatory authority of drugs from the Attorney General to the Secretary of Health and Human Services. And again, we think that's important because we think we should treat drugs through a public health lens versus a criminal justice lens. And similar to the MORE Act, the bill would expunge drug criminal records and provide for the resentencing of convictions, and it reinvests in alternative health-centered approaches, which is really important to make sure that people are living healthy lives. The bill also eliminates many of the lifelong consequences associated with drug arrests and convictions, including the denial of employment, public benefits, driver's license, and voting rights. All of these are collateral consequences, so the bill would get rid of that. There's lots of work to be done around this bill at the federal level. As I said, it really is a bill that we wanted to push the envelope. We're still working to get marijuana legalization passed through Congress. But, we didn't have the MORE Act and the CAOA that was pulled out of thin air. That's because many, many years ago, people started with incremental bills and pushed, and those bills grew and support for those bills grew. And that's how you pass legislation at the federal level. I think a lot of people in DC get very frustrated by how slow things move. But, I think it's a fight that's worth it because this is how you get people on your side and build victories. So with the Drug Policy Reform Act, our plan is to reintroduce the bill in both chambers next Congress. This year it was only a House bill. We're currently looking for a Senate lead. And again, in the new Congress, we'd like to introduce in each chamber and continue to build support for the Drug Policy Reform Act. It's also a good opportunity to just educate people on the Hill, on the Congressional Hill, about a different way to approach drug policy. So we're very excited about that. So next, I want to talk about a really wonky issue related to fentanyl. Fentanyl has been all over the news lately for the past few years, and we watch this issue very closely. And like we've seen in the past, there is a lot of hysteria around fentanyl. And I'm not trying to take away from the fact that I want to be very real about the fact that fentanyl and fentanyl analogs are a driver of overdose right now. Illicit fentanyl in the street supply, and the illicit street supply is very scary. I think people need to be empowered with facts, but we've also seen a lot of misinformation around fentanyl. And unfortunately, rather than pushing for, a public health approach to drugs, including overdose, Congress is taking what I think is the easy way out, which is more criminal penalties attached to drugs. Rather than pushing for things like naloxone or fentanyl test strips or opening up access to addiction services, we're seeing more of the same, and people really coming down on fentanyl and fentanyl analogs through the criminal justice system. So the policy that I want to talk to you all about is one that really originated years ago in 2018. This was during the Trump administration when we first started to see fentanyl pop up in the illicit street supply. At the time, the administration made the decision to use an emergency authority to schedule all fentanyl-related substances. So these are fentanyl analogs. In other words, they're chemically similar to fentanyl, derivatives of fentanyl. He made the decision to schedule them all under Schedule 1 status. So automatically, all of them got placed as Schedule 1 controlled substances. And this is really concerning because they made that decision based on chemical structure alone. And to this day, the vast majority of these substances have not been tested for actual bodily harm. And that's, and let me back up and just say why the testing is important. Normally, when you schedule a drug, you have to understand how it impacts the person's body. There's robust testing that HHS must conduct. There's a whole medical evaluation and scientific evaluation that they have to conduct on a substance to understand how it interacts in the human body, and if it even belongs on the CSA at all, or if it does, where on the schedule it belongs. This cuts the science out and says, okay, because all of these drugs are similar, chemically similar to fentanyl, we're going to treat them all as equally harmful. It's kind of wild when you think about it too, because fentanyl itself, as many of you know, is a Schedule 2 drug because it does have medical value. If you use it correctly under a doctor, it's safe. But fentanyl analogs actually behave differently depending on the substance, which is why it's really important that you test each substance. We know that some are inert. We know that some act like antagonists, like naloxone. They're all over the place, which is why it's really important that you test before you schedule it, rather than treat them all the same. And by the way, we've never done that with any other substance. We've always done the individual testing before placing them on the schedule. Unfortunately, the Biden administration is asking that Congress make this class-wide scheduling policy permanent. And this is despite our concerns, including that it impedes research into treatment for opioid use disorder because it's on Schedule 1. Schedule 1 drugs are really hard to also research. And we know that it will subject people to really harsh criminal penalties for untested substances that may be inert, have no impact on the human body, or that could even be helpful, especially when we're talking about treating opioid use disorder. So this policy at this point started under Trump, but it's up to Congress to decide what to do with it. And they've decided to kick the can down the road every time this policy was about to expire because it was a temporary policy. So it really is up to Congress to decide what to do ultimately about the policy. And this year they have to decide by December 31st of this year. And once again, they're going to have to decide, will they once again temporarily extend the class-wide scheduling policy and treat all these substances the same? Two, will they allow the class-wide policy to expire and go away, which is what we've been saying that they should do? Or will they make this policy permanent? We're asking Congress instead to pass the TEST Act. So this is the bill I wanted to talk to you all about. The TEST Act would extend the policy for another 2 years, but we're doing that in order to give the government time to fully test the fentanyl-related substances it has already identified. We know that as of December of last year, they've only identified 44 fentanyl-related substances under this class-wide approach. We believe that the test results will help us build evidence proving our case that this policy is overbroad, that it includes substances that are inert, some that can be helpful. And we believe that we can use this evidence the next time Congress has to confront this policy. So in 2 years, if the bill passes. So this bill, led by Senator Cory Booker, was really inspired by a congressional request that the senator and other lawmakers, including members of the House, made earlier this year to the heads of the DOJ, HHS, and the DEA, in which members of Congress expressed concern that a class-wide scheduling approach will set a horrible precedent. And that precedent is that helpful, harmful, and harmless substances can be preemptively treated as equally harmful and disregards basic principles of evidence and pharmacology. Their letter warns that Congress may inadvertently criminalize therapeutic medications similar to naloxone and other life-saving medications at the time when the U.S. is facing record numbers of overdose deaths. So we really see the TEST Act as a common sense solution, one that we're hoping that we build bipartisan support for. And let me just talk about the provisions of the bill to better explain that. So like I said, the bill will extend this class-wide scheduling approach for another 2 years. But the theory behind that is that in those 2 years, we really want them to test the substances that they've identified. So it will require the DOJ to publish and report out on all of the substances that they've encountered. We want to know what the testing revealed. Were those substances inert? Were they descheduled or rescheduled according to what you found? The bill would make it so that not only do they have to test, but then they have to move the substance off the schedule or to a different schedule, depending on what they find. So in addition to that, the bill notifies people who are currently incarcerated if a substance they're incarcerated for is descheduled or rescheduled. That way the person can have another shot in front of a judge at a resentence, at another trial, to hopefully lower their sentence. So because we're approaching another expiration date related to this policy on December 31st, we think that this bill is really going to pick up steam and link up. So either this month or next month. So I know that was a very, very wonky issue, and I hope I did not bore you to tears with my fentanyl-related substance talk. But I'm happy to answer questions in just a bit about fentanyl or anything else I talked about, especially if you wanted any clarifications about any of the issues that I just talked about. But before I do that, I did just want to talk briefly about other drug policy issues that we work on. So we really do a lot of different, we really, cover a lot of different areas is what I'm trying to say. Another big bucket of work that we do at the federal level is around harm reduction. So in other words, meeting people where they are and understanding that people use drugs for a number of reasons. And we want to keep people alive and connect them to health services. And that's a harm reduction approach. Specifically, we've been working to fund syringe service programs so people can visit SSPs and have access to clean syringes, but also things like fentanyl test strips. Every year, we've been able to successfully get more and more funding for SSPs across the country, but we still need more, especially given the weight of the overdose epidemic that we're looking at today. We're also fighting for overdose prevention centers. You all might have read that New York just last year opened up some overdose prevention centers. There's currently a case in Philadelphia where the DOJ is supposed to weigh in as early as Monday, actually, on whether or not OPCs will be allowed to operate in the US. OPCs have been successful in other countries. We know that they're a life-saving way to not only keep people safe while they're using drugs, but also, again, connect people to much needed health services. So that's a big bucket of our work. In addition to that, we do focus on collateral consequences. I talked a lot about collateral consequences during my talk here today. The drug war is vast. The drug net touches so many aspects of a person's life. So for example, one issue that we're working on is lifting the ban on people with drug convictions from accessing SNAP and TANF benefits. These are benefits that can help people feed their families, but in many states, if you have a drug conviction, even for something like low-level marijuana possession, you're not allowed to touch these federal benefits. And really that punishes families, it punishes children, it punishes people who use drugs too. And we want to talk about that because that's another way that stigma shows up. So we've been working to repeal that law at the federal level and other collateral consequences as well. We also work on policing. I mean, I think it's the ways in which policing and the drug war intersect are vast and broad. So we work on militarized policing, specifically on programs that literally give police military equipment in the name of the drug war. So we've been working to eradicate and end those programs. We also work on things like no-knock warrants and quick knock raids. These are warrants and raids that are used often by police in order to go after people who are supposed to be high-level drug sellers. But, you know, we really, you know, are invested in police reform because we understand that policing in its various forms, is harmful for people who use drugs. So we're definitely in the policing space. And, you know, it's one of the harder areas that we work in. Policing is a very tough issue in Congress, even tougher than broad criminal justice reform. Nonetheless, we understand the harms that policing brings to the communities that we serve. So it's a priority issue for us. So last but not least, I wanted to talk briefly about how you all can get involved. We love working with public health professionals. You know, I think as an advocate and as a lobbyist, I never feel that I'm as effective as people with lived experience and people who have a public health and science background. And that's because, you know, a lot of the issues, especially some of the issues that I talked about today, we're talking about people's health. We're talking about public health issues, really. So we really do love to incorporate public health professionals in all of our work, from, you know, folks from the scientific community, researchers, doctors, all of it. We always love to have support from those communities. And there are various ways that we ask folks from the public health community to support us. One common way is through sign-on letters. So for example, the fentanyl bill that I was talking about, we circulated a sign-on letter not too long ago asking for public health professionals to join that letter and stand with us and ask that the government test these substances before criminalizing them. We also hold various briefings and hearings where we ask for public health professionals to participate. So one example of this is just next week, actually, we're having a two-part briefing in Congress around drug decrim and the Drug Policy Reform Act. And each panel is filled with doctors and public health professionals, because again, you all carry so much weight with lawmakers, weight that you know, we certainly can't carry as advocates. Media opportunities. So just recently I worked on a letter again around fentanyl with a couple of scientists, and now they've been engaging with the media, talking to them about why it's so important that we test fentanyl related substances. So again, we love to uplift other voices, especially directly impacted voices and people doing the work on the ground, like public health professionals. But I would just say, you know, continue to follow the Drug Policy Alliance, or follow us if you don't already follow us. You'll see our website right there. Please look for this member newsletter. You can sign up to receive newsletters and see what we're up to. You could also sign up to check out, you can also sign up and give us your email, and then we'll regularly give you updates about the work that we're doing. So there are plenty of ways to keep up with us and know what we're doing. If you're on social media, I encourage you to follow us on social media. I didn't put our social media handles on here, but if you visit Instagram, Twitter, or TikTok, you'll see that we're all over the place, Drug Policy Alliance. That's another good way to engage with us too. If there are opportunities for folks to sign on to things or sign a petition, we'll always post them on social media. We also post a lot of educational things on social media too. So that's it. I know that was a lot. I would love to answer any questions that folks may have.
Thank you so much, Maritza, for that just thorough and informative talk, and challenge for us to really step outside the walls of the clinic or hospital to become involved. I do want to open it up, as Maritza said, for any questions from the audience. Either unmute yourself or put it in the Q&A chat. And while we're waiting for that, I did have one question. In terms of helping to push the it looks like 3 bills that are presently in Congress in the various chambers, what role can physicians play with that, specifically the MORE Act? In addition to briefings and hearings, is there a role for physicians reaching out to their state representatives, or what role can we play in that way to push it along?
Yeah. Other than the ways I described, you raise a really good point about just, the power of being a constituent, which is another reason that you all should follow the Drug Policy Alliance, because we'll connect you to your member of Congress. And when we ask you to sign petitions, we'll automatically do the work for us. You tell us your address, we'll tell you who your member is, and you can help us push along these bills. I think another way is just continue to do educational events like the one you're doing tonight, explaining what these bills mean and how they can be life-changing, essentially just educating the community. I think that's really important. And then I think that, a lot of the time people think that you have to talk to members of Congress or important lawmakers to make a change. But I actually think that a lot of the change that we make is with our own friends and families and our own communities. So even talking to your loved ones, people who respect you and people who you respect about these issues, that's power, because this is how ultimately we do change the culture of this country and we do change the laws, is by talking to your folks and educating them on these things. That to me is way more powerful, than, calling up your congressman, which is also important. But, we forget that the person-to-person contact, your individual contacts, your relationships, those matter as well.
Great. No, I love that.
Yeah.
And secondly, it seems, and I'm partial to psychiatry as a psychiatrist, substance use, mental health, they're intertwined, interconnected, and oftentimes they're seen as two separate issues. So I'm curious if you all have been pushing, if there's any fine print within the bills, to perhaps divert individuals that are using substances to mental health programs, or even expand the resources or psychiatric workforce in hopes of shifting that balance and shifting it from criminal punishment to a more, as you mentioned, public health approach?
Yeah, so that's a really good question. We believe that all treatment needs to be non-coercive, because otherwise it would just be replicating what we see in the criminal punishment system. We're not trying to force people to go into any sort of treatment. It really needs to be non-coercive, and people really need to invest in that themselves. And one thing that we have thought a lot about, I did say we don't work on treatment. We believe that treatment should be expanded. Drug treatment should be expanded. There's a lot of organizations doing great work around drug treatment, including medication-assisted treatment. We focus on harm reduction. So harm reduction, again, is meeting people where they're at without judgment, giving people education around drug use so that they use drugs safely, so that they stay alive, and so that we can connect them to health services when they're ready for that in a non-coercive way. But something else that we're starting to explore and that we really need to build our work around is co-responder models. And this kind of gets into what you were talking about, because and this also builds in the policing work. We've been saying we need to get the police responses out of drug use and out of mental health episodes, and oftentimes people may be suffering from both, or they feed off of each other. We believe that in those instances, we need to come up with models where the police are not involved, but again, that we're providing people the services that they need in a non-coercive way. That's an area that the Drug Policy Alliance is trying to be a thought leader around and develop more. But ultimately, again, we support harm reduction and we support non-coercive methods of getting people help.
Great. Thank you for that answer. Are there any other questions for Maritza while we have her? I know it's a lot to digest, and the information, the slides, and the recording will be available. Okay, well, if there's no further questions, I would like to close today's event by thanking Maritza for this informative discussion. We're so grateful to have you join us and looking forward to collaborating with you and the Drug Policy Alliance moving forward. For our attendees, before you leave, a couple of quick reminders. Please take 2 minutes to complete our survey so we learn more about you and what went well and what sessions you would like to see in the future. You'll find the survey link in the chat. Also, just generally, thank you for being here and for all you do on behalf of patients. We hope you will become an official DFA member today and take a look at the benefits of membership on the website. The number one reason doctors, medical students, and health advocates join DFA is to be with like-minded people that share the same values and priorities. Please remember to follow us on Twitter, LinkedIn, and Facebook. In addition to, as Maritza mentioned, the Drug Policy Alliance, to stay tuned with the happenings in this space. So thank you again, and have a great rest of your evening. Thank you very much, Maritza.
Thank you so much. This was wonderful. Thank you.
You're welcome.
Good night.
Good night.